subcommittee, and as soon as we have a quorum, we will announce that. We will be going ahead. We will have time limits. We'll hear 2 witnesses per side on each issue with a limit of 3 minutes each. If we had 3 people who want to speak for 2 minutes, that's fine. It's but 6 minutes of testimony in either direction. There are no bills proposed for a consent calendar today, so we have 6 bills before us. We will have a substitute member today. Mr. Cooley will be replacing Mr. Gomez, who's ill, and he is ill. I saw him yesterday. He wasn't looking so good. So. We are changing the agenda order up a little bit. Our first bill presented will be by our Speaker Emeritus Atkins. She's going to be presenting item 4, and that'll be followed by Assemblymember Bonilla, who's going to be presenting AB 1823. And thereafter, we'll return to our regular order. So at this point, I'd like to call Speaker Emeritus.
Thank you, Mr. Chairman, and congratulations to you.
Thank you.
It's a pleasure to be here today. I am here to present AB 1795, which will close 3 specific gaps when it comes to providing life-saving breast and cervical cancer screening and treatment for low-income Californians. First, currently, the state's Every Woman Counts program provides mammograms to low-income and underinsured women, but only women who are 40 or older can receive breast cancer screenings. For example, if an income-eligible 35-year-old woman goes to a clinic for an OBGYN checkup and the doctor discovers a lump in her breast, her mammogram would not be covered under Every Woman Counts. And that's scary because we know that breast cancer can be far more aggressive in younger patients and more likely to lead to death if not diagnosed early. And there's no good reason that younger women shouldn't also be covered. Second, currently the state's breast and cervical cancer treatment program provides treatment for breast and cervical cancer, but not if there is a reoccurrence of the same type of cancer in the same part of the body. Another example, let's say a woman in this program has breast cancer in her right breast and then goes into remission. If her cancer later comes back in the same breast tissue, she would be denied treatment. Yet if her cancer comes back and has metastasized to her lungs, her treatment would be covered. That's a real-life example of a woman I talked to earlier this week. It makes no sense. It's just an arbitrary line drawn in the program. And third, currently the breast and cervical cancer treatment program stops providing treatment after 18 months for breast cancer and 24 months for cervical cancer. This also is an arbitrary cutoff. Not all women are alike, and not all cancers are alike, and it really should be the doctor that makes the determination with his or her patient in terms of the treatment plan. Some women need more time, and it should be given to them. And the best, most effective way to keep Californians healthy is to detect problems early and begin treatment immediately. And unfortunately, those principles aren't always followed in state law. And AB 1795 would fix that with respect to this program and these examples. So joining me today to testify in support of AB 1795 are Dr. Jessica Less, a 2-time breast cancer survivor and a primary care physician with Vista Family Health Center in Santa Rosa, and Angela Blanchard, representing Komen Foundation. I would turn it back to you, Mr. Chairman.
Great, thank you. So you'll each have 3 minutes. Thank you.
Good afternoon. I'm Dr. Jessica Less. I was first diagnosed with breast cancer at age 28. I had student health insurance at the time, so I was lucky and received state-of-the-art treatment. Unfortunately, I was diagnosed with breast cancer again at age 33. After I completed my second cancer treatment and regained my strength, I started working at Vista Family Health Center. The majority of our patients have Medi-Cal or are uninsured. One of the first patients I diagnosed with breast cancer was a single working mother. She was uninsured in her early 30s and had a breast lump, but we couldn't get the breast imaging and biopsy she needed. She was under 40, so she was too young to qualify for Every Woman Counts, and she didn't have enough money to pay the hundreds of dollars out of pocket for the breast imaging and the biopsy herself. Many months later, my uninsured patient ultimately did get her breast imaging and her biopsy, and then, of course, her diagnosis. But I still wonder today, did her cancer grow while we waited? Did her cancer spread to her lymph nodes while we waited, increasing her risk of recurrence? If I had been an uninsured or underinsured woman when I faced both of my breast cancers, all three aspects of AB 1795 would have completely changed my life. I was diagnosed with breast cancer at age 28 and 33, well below the age cutoff for every woman counts. I had a recurrence of the same cancer on the same side in scar tissue, and I would therefore would not have qualified for BCCTP for my second cancer. And my second cancer treatment happened to last longer than 18 months. I would be thousands of dollars in debt. Breast cancer can and does hit young women. Breast cancers can and do recur. And some breast cancers take longer than 18 months for treatment. That's why the expansion of BCCTP and Every Woman Counts is crucial. Thank you.
Thank you.
Good afternoon, Mr. Chair and members. Angela Blanchard on behalf of the California Collaborative of Susan G. Komen for the Cure, here to speak in support and as the sponsors today. Our collaborative is comprised of 7 affiliates statewide and represents over 100,000 breast cancer survivors and supporters in California. As Dr. Less and Speaker Emeritus Atkins have elaborated upon, the issue of young women being diagnosed with breast cancer and having that breast cancer be very aggressive is real. We know, based on a study of nearly 9,000 adults, that the breast cancer occurrence rates with women ages 15 to 39 represents approximately 5 to 6% of all cases. And we know that those cases are often more aggressive. I would also like to add that disparities amongst breast cancer patients is very real. While African American women and white women are diagnosed at the same rates, what we see with women under the age of 45 is that African American women are being diagnosed at higher rates. And what we see with those women is that they have nearly double the mortality risk of white women. We also see that Latina women are often tend to be diagnosed at later stages and than non-Hispanic white women. And this may be due to lower mammography rates as well as delays in follow-up to care. On a very basic level, what AB 1795 does is it ensures that that 33-year-old woman who finds a lump will have the ability to go to her provider and have her provider investigate what's going on. And if they find that she has cancer, she will be able to stay on her medication therapies treatment longer than 18 months if needed. And if that cancer comes back in the same breast with the same pathology, she will have that treatment covered. Currently, these arbitrary barriers to care do not exist within our Medi-Cal program or private insurance or within our federal breast and cervical cancer treatment program. So for all these reasons, we respectfully ask for your support on this important bill. Thank you.
Thank you very much. Others in support, just name an organization, please. Thank you.
Good afternoon, Mr. Chair. Tam Ma with Health Access California and strong support.
Mr. Chair, member Stephanie Roberson on behalf of the 90,000 registered nurses in the state of California and strong support.
Thank you.
Leah Barrows, I've been asked to speak today on behalf of American Cancer Society Cancer Action Network, and we are in strong support.
Thank you.
Michelle Gibbons with the County Health Executives Association of California and strong support.
Kelly Brooks on behalf of the Association of California Healthcare Districts, also here in support.
Good afternoon. Chris Rosa, representing the Cancer Treating Physicians, the Medical Oncology Association of Southern California, and the Association of Northern California Oncologists, also in support.
Greg Herner on behalf of the California Life Sciences Association. Very happy to be here in support of Speaker Emeritus Atkins in this bill.
Thank you.
And Shannon Smith Crowley, representing the American Congress of Obstetricians and Gynecologists, District 9, in support.
Thank you. Noticing we have a quorum, Madam Secretary, would you please take the roll?
Wood?
Here.
Mainshine? Here. Bonilla? Here. Burke? Here. Campos? Chu? Dababne?
That would be you. Yeah. Yeah, thank you.
Cooley? Hernandez? Lackey? Nazarian? Olson? Patterson? Ridley Thomas? Rodriguez? Here. Santiago? Steinnorth? Here. Thurmond? Here. Waldron? Here.
Okay, great. Thank you. Let's see. Any witnesses in opposition to testify? Seeing none. We have a motion, Ms. Bonilla, second by Mr. Hadley. The motion is who? Oh, him. Oh, yeah, that happens a lot. Sorry. Did that to you. Sorry, Mr. Steinhardt. The motion is do pass to appropriations, Madam Secretary.
Wood?
Yes.
Wood,
yes.
aye. Mainshine? Aye. Mainshine, aye. Bonilla? Bonilla, aye. Burke? Burke, aye. Campos? Chu? DeBobne? DeBobne, aye. Cooley? Hernandez? Lackey? Nazarian? Olson? Patterson? Patterson, aye. Ridley Thomas? Rodriguez?
Here or I? Okay.
Rodriguez, aye. Santiago? Steinnorth? Steinnorth, aye. Thurmond? Thurmond, aye. Waldron? Waldron, aye.
You will see we have a well-oiled machine here because I forgot to ask my members if they had any questions. So, Mr. Thurman, now that we have passed, the bill is now passed to appropriations, do you have any questions?
No, sir, Mr. Chair.
How about some comments?
But thank you for acknowledging me, sir. And I wanted to just thank the witnesses. Thank you for what you shared, and thank you to the work of the Komen Foundation. And I wanted to just add emphasis to what you said about how important this is for all women, in particular women of color and African American and Latino women. My mother was an Afro-Latina, and she had cervical cancer. And true to what you said, she lost her battle at a very young age. She was 37 when she passed away. And so, I can't offer much other than to want to add emphasis to what you said. The longer the treatment that's available, the better. And to me, should have been a no-brainer that we should make it easy for making more treatment as long as it's necessary. So thank you for your testimony. Thank you, Madam Speaker Emeritus, for bringing forward such an important measure. Thank you.
Thank you, Madam Speaker. And I should have let you close, too. This first in a series of blunders at some point. But anyway, thank you, Madam Speaker. It was an excellent close. Okay. Yes. Did you have a comment, Mr.
Kudos
Patterson?
on the well-run chairmanship on this.
Thank you, Mr. Jones. Ms. Bonilla, would you like to present, please?
Thank you very much, Mr. Chair and members of the committee. Today I present AB, and thank you very much for the recognition of the time constraints here of my witness. Mr. Chair and members, I present to you AB 1823, which establishes the Cancer Clinical Trial Program. It would increase access to cancer clinical trials for all patients, especially women and underrepresented communities. Currently, less than 1% of eligible cancer patients participate in clinical trials in California. That's pretty shocking. Less than 1% of eligible patients. And nationally, only 5% of participants are from underrepresented communities. So of that 1%, even far fewer are underrepresented or women. This means a majority of California cancer patients don't have access to potentially life-saving trials. Low participation rates also impact the researcher's ability to develop and evaluate effective, innovative treatments for the varying genetic makeup of women, men, and diverse racial and ethnic groups. Economic factors, ancillary costs, lack of awareness of available trials, and mistrust of the medical system have also been some of the largest barriers to participation in trials. AB 1823 targets these barriers through a privately funded grant program to be administered by the University of California. The grant program will provide funds to applicants for activities which would reduce the barriers. Programs such as patient navigation, physician education, community outreach, travel costs for participants and their caregivers, and patient-friendly IT tools to assist patients in identifying available trials. Through this program, California would be able to leverage private funding sources to help more Californians access cutting-edge treatment. AB 1823 is an innovative approach to address these barriers to patient participation in clinical trials, and I would respectfully ask for your aye vote. Today I have with me Dana Dornsife from the Lazarex Cancer Foundation and Angela Gilliard representing the University of California.
Before I let them go, are you taking the amendments, Ms. Bonilla?
I believe, yes, I am.
Okay.
Of course I am.
Of course. Okay. That was a good answer. Thank you. Please go ahead.
Good afternoon, Mr. Chair and members. My name is Dana Dornsife. I'm president and founder of the Lazarex Cancer Foundation in Danville, California, and a global philanthropist. Lazarex focuses on helping patients with all types of cancer, of all ages, and from all walks of life. We remove the barriers to clinical trial participation for patients seeking cutting-edge treatments through FDA clinical trials. Those barriers are primarily knowledge, lack of finances to participate and cover ancillary costs, and having to leave your support network at a time when it's needed the most. We also promote early-stage diagnosis to increase survival, especially for the medically underserved. For these patients, Lazarex is literally their last line of defense. Since 2007, Lazarex has helped more than 1,500 individuals seek new and innovative cancer therapies through clinical trial participation and pay for their ancillary costs. But each year, over 150,000 Californians are expected to be diagnosed with cancer. Lazarex is currently the only charity who does what we do. Our ability to support patients is directly related to the amount of money that we have raised. We need to scale up this model, and we specifically need to remove the concern of inducement so we can engage with industry to help cover these ancillary costs. That's why I'm here today to speak in support of AB 1823. AB 1823 establishes the Cancer Clinical Trials Program administered by the University of California. The program will be able to significantly expand the access and availability of services for these California cancer patients. Through AB 1823, many more Californians across the state will receive services like patient navigation to help patients identify trials, coverage of travel and lodging costs, education and outreach programs to reduce cultural barriers that exist in so many of our underserved communities. The Cancer Clinical Trials Program will be critical to reducing the barriers to cancer clinical trial participation that exist for all Californians. I urge you to support AB 1823. Thank you.
Good afternoon, Mr. Chair and members of the committee. My name is Angela Gilliard. I'm the Legislative Director for the University of California, and I represent the UC Health Systems. The university has been asked to establish the program that would administer a grant program that provides reimbursement for ancillary costs incurred by patients who participate in cancer clinical trials. The university supports the goals of the program and the Assemblywoman's leadership on this issue. We do not have a position on the bill at this time. However, we are actively working with the author's office and sponsors on program features and potential amendments to this bill. Once language is resolved, the university will have a position on this bill. We believe this is an important issue and ask that the committee move this bill forward while we continue our discussions.
Good afternoon, Mr. Chairman, members. Janet Lopez, representing the University of Southern California. We are a support if amended position right at this time. As cited in the analysis, we are having discussions with the author and the University of California on the board structure, but we are very supportive of the proposal and look forward to working with the Assembly member and stakeholders on the issue. Thank you.
Great. Thank you very much. Others in support, name and organization only, please.
Jerry Jeffy, representing the California Chronic Care Coalition. The coalition is in support of the bill.
Greg Herner on behalf of the California Life Sciences Association. We supported last year's measure. We're still working through the language as well, but we're very supportive of moving the bill forward.
Thank you.
Kelly Brooks on behalf of the Association of California Healthcare Districts. We're very supportive of reducing health disparities and are here in support today.
Thank you.
Leah Barrows on behalf of Susan G. Komen California Collaborative, and we are in strong support of this bill.
Tam Ma with Health Access California in support.
Chris Rosa on behalf of the Medical Oncology Association of Southern California and the Association of Northern California Oncologists in support.
Great, thank you. Any witnesses in opposition? Seeing none, we'll come back to questions from the committee. Ms. Waldron.
Thank you, Mr. Chair. Just a question. This seems very innovative, and I was wondering, since only 3% of eligible cancer patients or even know about a clinical trial or participate in, only 5% of those are from underserved communities, and we need that diversity in the trial, for a lot of scientific reasons and important reasons. Have other states done similar things, or would we be the first?
I believe we're the first. I'm not sure if Ms. Dornsife has.
Yeah, last year through this similar effort in AB 1060, California was in fact the first state to address this. However, currently the state of Pennsylvania is undertaking a similar position.
Yeah, I mean, I know people personally who were told, gosh, get your affairs in order, and they participated in a clinical trial and went on to live sometimes 10 years.
We could literally fill this room with patients who have done the same.
Yeah, so the benefit I can clearly see, and I support the bill.
Move the bill.
Second.
Any other comments from members, questions? Ms. Bonilla, would you like to close?
Well, thank you very much for your consideration. We did have this bill last year, and the main change in the bill was we were going to put the foundation in the Department of Health. The administration suggested we might begin our discussions with the UC system and place it there, and that's the primary change in the bill this year. We believe it's very important, worth pursuing, ironing out every single detail. We believe that this is also a bonus to the patients that we've been discussing, also to our research institutions here in California, to the fact that the president has stated that the cures of cancer is something that we are pursuing. We want California to be in the forefront of that. We believe there's even economic benefit to the state of California for being the place where our pharmaceutical companies can actually come and fill up their drug trials. It saves them time, which is an amazing cost savings also to the pharmaceutical industry. So we believe the whole way around this is a very important measure, primarily for our constituents, and thank you so much for your support and ask for an aye vote today.
Thank you, Ms. Bonilla. And the motion is, or the recommendation is going to be do pass to actually
as amended.
As amended to higher ed. And I just want to commend you for bringing this bill back and trying to address this and address the concerns in the veto message from the governor. I think it's a great concept, and it's very worthy of being brought forward back to us. So thank you for doing that. And with that, I'll have the secretary call the roll.
Wood?
Aye.
Wood, aye. Mainshine? Mainshine, aye. Bonilla?
Aye.
Bonilla, aye. Burke? Burke, aye. Campos? Campos, aye too. Dababne? Dababne, aye. Cooley? Cooley, aye. Hernandez? Lackey? Aye. Lackey, aye. Nazarian? Olson? Patterson? Patterson, aye. Ridley Thomas? Rodriguez? Aye. Rodriguez, aye. Santiago? Steinnorth? Aye. Steinnorth, aye. Thurmond? Aye. Thurmond, aye. Waldron? Aye. Waldron, aye.
13-0.
Motion passes 13-0 off to higher ed. Thank you, Ms. Bonilla. And also, I want to just mention our newest members of the committee joining us today, Nora Campos, Assemblymember Campos, and Assemblymember Dababne. And I thank Mr. Cooley for filling in today for Mr. Gomez. And I failed to mention Mr. Chu is on paternity leave. So I talked to him. He's been changing a lot of diapers. And seriously. No, he got the poop on him. Excuse me. Him. Not me. So thank you. So we are going to move on to Mr. Dodd has the next item for us.
Good afternoon, Mr. Chair and members. AB 1655 would increase the Personal Needs Allowance, PNA, for Medi-Cal-eligible individuals who live in a medical institution, nursing facility, or receive services from a program of all-inclusive care for the elderly, acronym PACE, organization from a $35 a month to $80 a month and annually adjust the personal needs allowance by the same percentage as the Consumer Price Index. The personal needs allowance is what the Medi-Cal eligible institutionalized individual is permitted to keep from his or her own monthly income. The remainder of the resident's income goes to the nursing facility for their share of costs and reduces the amount the state agency pays the nursing home. California's payment to the nursing home facility is matched by the federal government at the federal medical assistant percentages FMAP rate of 50%. California's PNA was last set in 1984, and residents in nursing facilities have not received a cost of living increase since then, despite the rate of inflation that we've had over these many years. A 2009 report by AARP, Public Policy Institute, demonstrated that California had one of the lowest PNAs in the country, with only Alabama, Illinois, Missouri, and North Carolina using a lower allowance. The PNA is critical to enhancing the quality of life for residents in nursing homes, covering the costs of clothes, shoes, personal care items like adult diapers, reading materials, postage, and meals outside the facility. Currently, the PNA does not adequately fund these costs, and our seniors and those living in facilities without familiar support suffer through isolation and indignity of not being able to cover their basic personal needs. I would like now to introduce my two expert witnesses who can further expound upon the dire need for passing this legislation. Sue Walker with the California Senior Legislature, and Krista Kelamitos, the Executive Director of the Senior Advocacy Services Ombudsman Program in Petaluma.
Yeah, just note, Miss, we have a motion for Mr. Ridley Thomas and a second by Ms. Waldron. So, okay. Please, with your witness. Please.
Good afternoon. Dear members of the Health Committee, elected officials, and interested supporters. I am Susan Walker from Lake Arrowhead, and I am a senior assembly member of the California Senior Legislature, or CSL. CSL just celebrated its 35th anniversary and continues to be an advocate for California seniors. We are 120 strong throughout California, 40 senior senators, and 80 senior assembly members. CSL's primary focus is to put forward proposals that will benefit California seniors. My proposal was third on the list of their top 10 to raise the personal needs allowance for Medi-Cal nursing home residents before you as AB 1655. We thank Assemblymember Dodd for sponsoring the bill and for the many organizations and individuals who support this important bill. Our most vulnerable seniors, the Medi-Cal nursing home residents, have been forgotten. Their PNA was last raised in 1984, and now, in 2016, the inflation rate has climbed 128%. If the PNA is raised to $80, this will only give them the same buying power they had in 1984. Thursday, I visited the Mountains Community Hospital Skilled Nursing Facility in Lake Arrowhead. The 20 residents told me that they need an increase in the PNA for clothing, shoes, outerwear, it's cold up there, denture tablets, hearing aid batteries, personal care items such as a hairbrush or mouthwash, books, newspapers, and lunch outside the facility. If they want an essential part of your life, say the cell phone, then a family member has to pay for it. There is often no family member, so they do without. As you can see, $35 does not meet their needs. These are the support letters written by the nursing home residents and volunteers to ask you to support the PNA. Half of the increase of the PNA will come from the federal government. California could use more federal dollars in its economy, so all will benefit. Don't these seniors have a right to keep a fair share of their Social Security money that they work so hard for over their lifetime? Please help them to know that we appreciate their contributions to our state and let them feel some dignity and quality of life in their sunset years. A government is judged by how well they care for the most vulnerable in our society. The CSL seeks your support for AB 1655. Thank you very much.
Thank you.
Hi. My name's Krista Chelomidis, and I'm the Vice President of the California Long-Term Care Ombudsman Association. I'm the Executive Director of Senior Advocacy Services, and I'm the Program Manager for the Sonoma County Ombudsman. I come to you as an advocate for the residents of long-term care. Raising the personal needs allowance from $35 to $80 is a tiny investment in the resident's life, but a huge impact on their quality of life. Remember, these custodial residents are only provided, as mentioned, with their basic needs of food and shelter. No other expenses are covered. Any of the money from their pensions that they've earned over a lifetime are taken from them. As an example, most of these people are really hardworking individuals. They make $2,500, $3,000 a month. But that is not enough to cover. So that is taken and the balance is paid. These are honest, hardworking Americans who simply can't pay the outrageous cost of long-term care. They plan for their retirement, they work to accomplish it, and living in a skilled nursing facility was probably never in their plan, much less trying to live off of $35 a month. I don't think anyone sitting in this room today can imagine what it's like to have $1 a day to live off of. So much for your Starbucks. None of that. They have to purchase denture cream, hearing aids. She mentioned a lot of them, so I won't reiterate that. But I just want to tell you a quick story. I was recently visiting a skilled nursing facility, and a gentleman that I regularly see wasn't wearing his hearing aids. And he is stone cold deaf, let me tell you, without those hearing aids. And I asked him why not, and he said, well, I couldn't buy my batteries. And so, of course, I asked him, and he said, I wanted to spend the money on a gift for my grandson's graduation. This man chose to not hear for over a month for that simple reason, so that he could have some sense of a relationship with his family. That's a dignity issue. So please help these residents not have to make these types of choices and regain some of that dignity. And thank you for the opportunity to speak on behalf of the residents of long-term care.
Thank you very much. Other witnesses in support?
On behalf of the San Bernardino County Board of Supervisors in support.
Thank you.
Lisa Coleman on behalf of CalCOA, the California Long-Term Care Ombudsman Association, which represents the 35 local ombudsman programs, in strongest support.
Thank you.
Senior Assembly Member Ann Warren from California Senior Legislature, and we hope that you pray that you pass this one.
Thank you.
Thank you.
Gary Passmore with the Congress of California Seniors. We too support this bill very strongly. It's way overdue.
Thank you.
Good afternoon, Mr. Chair and members. Beverly Yu with UDW, AFSCME Local 3930. We strongly support this bill.
Thank you very much. Any witnesses in opposition? Okay, seeing none, I'll bring it back to the committee. Any comments, questions? We have a motion and a second. Would you like to close, Mr. Dodd?
Just respectfully ask for your aye vote.
Okay, we have motion and a second. Motion is due pass to appropriations. Madam Secretary, please call the roll.
Wood?
Aye.
Wood, aye. Mainshine? Aye. Mainshine, aye. Bonilla? Bonilla, aye. Burke? Burke, aye. Campos? Campos, aye. Chu? Dababneh? Aye. Dababneh, aye. Cooley? Aye. Cooley, aye. Hernandez? Lackey? Aye. Lackey, aye. Nazarian? Olson? Patterson? Patterson, aye. Ridley Thomas? Aye. Ridley Thomas, aye. Rodriguez? Aye. Rodriguez, aye. Santiago? Steinnorth? Aye. Steinnorth, aye. Thurmond? Aye. Thurmond, aye. Waldron? Waldron, aye.
Mr. Dodd, your bill passes 14-0. You're off to appropriations. Thank you very much.
Thank you, Mr. Chair and members. Thank you very much.
Thank you very much.